So the main aim of the study was to determine the prevalence of advanced fibrosis, F3, F4, and the prevalence of MASH cirrhosis, so just F4, in the general US population. And to do this, we actually utilize a nationally representative database called the NHANES database. So this is a project by the CDC, where typically every couple of years, they call them the NHANES cycles. They take about 30,000 individuals in the US that represent the demographics of the US population. And they do blood pressure, BMI measurements, they do questionnaires, they do a routine blood test. But since 2017, they actually started doing VCTE and selected patients. So we have a large sample size of well-characterized patients that have transient elastography done. So we utilize this database to estimate the prevalence of advanced fibrosis and cirrhosis. And because of the low PPV of just liver stiffness, we decided to utilize the AGILE 3+ and the AGILE 4. And we are actually conservative, so we use just the upper cut point that maximizes positive predictive value, okay? By looking at these scores, number one, with the AGILE 3+, we estimated that probably 8.1% of the population is at risk for advanced fibrosis, F3, F4. And we estimated that maybe 1.1% of the population is at risk of having MASH cirrhosis. These numbers translate into about 4.5 million American adults at risk for advanced fibrosis, and about 600,000 Americans at risk for cirrhosis. Now, these numbers may underestimate, may overestimate, but I think we took a conservative approach, and that's why I think these numbers are very alarming. I think, some other studies estimate that probably 2 to 3 million people might be at risk for MASH cirrhosis, but even with the very conservative approach, we're talking about 600,000. And his database has some limitations. Of course, there's a little bit of a selection bias. There are some underrepresented populations. There are some nuanced things like the amount of alcohol consumption. It may affect some of these estimates. But again, the message for me is that even by using a conservative approach, a large percentage of the American adult population may have advanced fibrosis related to MASLD and MASH. The other message is that, obviously we want to identify patients before they progress to MASH cirrhosis, because we have very effective approaches now. If you identify them early enough, we have very effective ways to help them with their weight loss journey and achieve that 10% threshold of weight loss. And then as they progress, also now we have FDA approved medications that may actually lead to a reversal of fibrosis. So I think it is very important that we actually utilize these scores and utilize them properly. We don't want to overdiagnose people with advanced disease and put them unnecessarily on medications, but we also don't want to continue with this sense of there's nothing you can do about it, because there's a lot that you can do about it. So we need to do NITs early on, utilize them effectively, and intervene.